Airway management, airway, airway, airway. It's all about the airway. The advanced stuff is nice, but basics is what's going to save your patient. So when we talk about single person BVM or bag valve mask management, we try to preach two person because it's more effective. However, you know and I know, anybody who's been out there, a lot of times you're doing this by yourself. And that's not a problem as long as you do it the right way. Right way, of course, use your BSI. Make sure you have your face shield on to protect your eyes, protect your mouth. Patient, whether they are breathing on their own or they are apneic or without actual ventilations in and of itself, you want to make sure you have good head position. And in the adult that is non-traumatic or an atraumatic patient, you're going to hyperextend the neck just a little bit. You don't want to go too far, just a little bit. Select the proper size mask, adult BVM, which will be hooked up to 100% oxygen. For the purposes of this video, we're going to forego that. Make sure you've got your mask the right way up. In a stressful situation, it's funny to see how many people have this mask upside down, and they complain that they don't have a good seal. Right side up, over the bridge of the nose, covering the mouth, and you're going to utilize what's known as the OK hold or the EC hold. Have your C or your OK on top of the mask, one thumb at the nose, one finger down here, and these three fingers are going to come right up underneath their chin and just lift up a little bit. So as you apply pressure, you don't want to put too much pressure. That's not what we're looking to do. A little bit of downward pressure, three fingers under their chin, bring them up just a little bit, and all we're looking to achieve here is rise and fall of the chest. About 6 to 10 times a minute, depending on patient status, is all you want to do. Nice and slow. Introduce that breath over a few seconds. Allow for full recoil of the chest. Biggest key, though, is getting that seal. You don't need a lot of downward pressure. You don't want to dig your fingers up into the soft tissue under the chin. Things that are going to affect this seal are going to be facial hair. There's going to be some facial fractures. We'll deal with that another time. But for now, making sure you've got the right seal, EC hold, gentle pressure, a couple of fingers under the chin, pull up and back, good tidal volume, rise and fall of the chest. That's all we're looking to do here to get good, effective one-person BVM management.